Many students with FASD have difficulties understanding cause and effect relationships and controlling impulses. The prenatal exposure to alcohol has caused brain differences that make predicting outcomes difficult. Some students with FASD, then, often have trouble seeing the potential results of their actions, learning from experiences, understanding consequences, and seeing that their behavior affects others. It is so important for educators to acknowledge that the learner may have a physical brain injury and may have difficulties processing next steps or outcomes. Now, how do educators work more effectively with a student who has difficulties with cause and effect and impulsivity? Using our LEAK planning tool as a framework for problem solving, many accommodations can be developed that will support this student and this primary disability. The first step in the LEAK analysis is to look at the learner. As always, educators need to develop a good rapport with students and get to know their strengths, areas of need, and their interests. Developing this relationship and knowledge provides more insight on the observed behaviors and allows educators to anticipate and prevent many behaviors before they begin. Many students with FASD display uneven maturation in different domains. For example, a 14-year-old student may display age-appropriate gross and fine motor skills, but may be at the level of an 8-year-old socially and emotionally. Knowing the approximate developmental levels in various domains will help in planning appropriate activities and alter the expectations placed on the student. Educators also need to determine the academic levels of the student and start at a level below to build on success. As well, educators need to acknowledge and utilize the student's strengths in planning an effective program. Success in a classroom encourages more positive behaviors. A key point is to look at the behaviors and link them back to the disability of the brain. We need to ask, how can we accommodate this disability and utilize all of the specific information we know about the student? The next step in the LEAK analysis is to look at the environment of the classroom and school. Please refer to the Classroom Environment module for more detailed information about setting up your classroom. However, here are some of the more important environmental accommodations educators can make for a student with FASD who struggles with cause and effect and impulsivity. It is sometimes helpful to take a look at the classroom and school environment from the perspective of the student and remove or cover up potential distractions from the view of the student. Seat the student at the front of a row or in an area where distractions are kept to a minimum. In the classroom, try to provide a quiet place for the student to go to when he or she is feeling overwhelmed. Provide plenty of activity breaks for the student. Use visual supports to provide a list of jobs, the day's schedule, classroom rules, and reminders or prompts. Allow the student who is tactile seeking to have a fidget toy, something that provides a sense of comfort and calm. A koosh ball or clay are good examples. For some students, a visual timer may help to keep them on task and focused. The next step of the LEAK analysis is to look at the instruction, or what aspects of our teaching that we can change or adapt to accommodate the student's inability to see cause and effect. First of all, it is crucial to link the developmental and academic levels of the student to the work expectations. Also, provide positive, consistent, and immediate consequences along with reminders about why the consequences are in place. An example of a positive strategy for teaching cause and effect and for getting more completed work is to use the Premack Principle. This is a strategy where the student is rewarded with a choice activity once a specific task is completed. A variation of this is using if-then statements for students who understand that a desired activity follows a task. If you complete the 10 math questions, then you can play a quiet game. This high school teacher enjoyed some recent good success with the implementation of the if-then statements.
All I need to do is say, well, take a look at the board. These are the expectations. If you do this, then this is something that you will get. from that. And it works really well for them, especially seeing it up on the board. It's very simple. And it now I don't even have to point at the board. They know already where it is. And they'll remind each other, look at the board, look at the board. You're not respecting classroom property, and then you're not going to be able to borrow a ruler or pencil, crayons, or whatever. So it's helped a lot, and I'd use it in any classroom.
Another important instructional accommodation educators can provide an impulsive student is constant and close supervision. Individual students with FASD need varying levels of supervision and need to know that someone is there to provide assistance when needed. Just being visible to the student is often enough to remind them to stop and think before choosing an action. Establishing a structured classroom and having consistent routines that are reviewed often provides the student with a sense of comfort and an environment that they are able to function effectively within. Providing frequent feedback and evaluation of students' work can help to give the student a sense of accomplishment and encourages the educator to make contact with that student frequently. Acknowledging the fact that the student with FASD will need frequent reteaching and many practice opportunities to learn appropriate actions and responses. Patience and empathy from the educator are critical. When possible, use a teaching assistant and the student's peers to provide assistance or direct one-on-one support when the curricular demands are greater. And finally, as with all good teaching, educators need to take a step back and ask why an intervention did or didn't work. As teachers, we need to constantly reflect on what we can do differently to support the unique needs of our students. The next step in the leak analysis is to make accommodations to the curriculum that will allow the student to experience success. A great teaching idea for cause and effect is to use sequencing activities. Because of the difficulties some students with FASD have with time concepts, sequencing is a skill that will need direct teaching. Using picture stories that can be taken apart, mixed up, and put back together in proper sequence is one activity to try. For older students, the second step photo cards are great for getting students to think and talk about what might happen next in the pictures that depict social situations. Social stories are powerful tools in teaching appropriate behavior and helping students to see how their behavior may affect others. By reviewing this script frequently with the student, they begin to make sense of what the behavioral expectations are and how their behavior can affect others. This accompanying slide shows an example of a social story. Another great strategy for a student having trouble with impulsiveness and cause and effect is to teach problem solving and show how to reflect on behaviors. Step 1, what is the problem? Step 2, what are my options? Step 3, choose one and act. And step 4, ask the question, did it work? By working through this simple problem-solving sequence, students with FASD, with the help of a visual, may begin solving problems more independently. This is an important life skill that will assist them throughout their lifetime. There cannot be enough said about planning learning activities based on students' interests and strengths. If educators can hook their students through interesting activities, content, and creative teaching methods, we have a much greater chance at keeping that student interested and on task. Also, try to use hands-on materials whenever possible. Try to adapt the classroom activities in a way that allows for meaningful participation. All students need to feel that they belong and are contributing members of the classroom. Most importantly, educators need to make the curriculum fit the student. By adjusting the teaching methods, the levels of support, and the resources, educators can teach the curriculum and meet the needs of all their students. Students with FASD may never overcome their difficulties with cause and effect and impulsiveness. Viewing FASD as a physical disability helps educators to understand the importance of providing accommodations. When educators shift their thinking away from behaviors as being willful or intentional and focus more on supporting these primary disabilities, our students and educators will experience less frustration and more success in our schools.